Hello everyone, welcome back to the channel. My name is Dr. Rosa, you can call me Dr. Rose, and today we're going to be talking about why so many tests, what's the difference between them, and what role do they play in me as a physician. So let's get right to it. So although I understand these tests are stressful, take a lot of time to be able to prepare for them, and for many pose an extra financial burden, these tests are of great importance to your medical training. But before we dive into this video, I know that there is a lot of discussion as to how this system evaluation should be modernized and all those little nuances that come with it. However, what I'm going to address in this video is how the current system is and why is it that way. So step one. The step one is given between the second and third year of medical school. It essentially evaluates the material you've learned from the first 2 years of medical school. Now, it is very specific in the topics and the details it evaluates. It essentially evaluates your overall medical scientific knowledge of these first 2 years. So your step 2 CK. This test is given usually between third and fourth year of medical school. This test covers your overall knowledge in patient treatment and management in multiple different medical specialties. Your step 2 CS. The step 2 CS is usually taken at some point on your fourth year of medical school. This test is kind of an acting test in which you're evaluated in a person-to-person setting of evaluating a person who is acting as a patient with a specific complaint. This test assesses your clinical skills, your patient-physician relationship, and your history-taking skills on a standardized setting. Now the famous step 3. The step 3 can only be taken once you graduate medical school and you have your medical degree. This 2-day computer-based test focuses on your overall medical knowledge covered anywhere from your first year of medical school all the way from your fourth year of medical school, and tests overall patient management in multiple different settings, either being office, hospital, intensive care, ED, urgency. Now, what role do they play in me being a physician? So step 1. Step 1 needs to be passed to be able to be promoted into third year of medical school. Now, why is that? Because we need to make sure that the student has a overall pretty good medical basis as that they're able to apply in a real life setting when diagnosing and treating a patient. So step 2 CK. So you've already shown that you know your medical material, and that once you're able to diagnose your patients, we need to know that you're able to manage and treat them accordingly. Also, although this is not a requirement to be promoted to fourth year, this is indeed a requirement to be able to not only graduate medical school, but also for application in for your residency. So step 2 CS. Even though every person's personality comes and plays a role in patient care, as well as I know by this point you've seen many different patients and taking care of many different patients, the step 2 CS aims to make sure that you're able to get an adequate history and perform an interview in a good and professional manner that allows you to gather all the necessary information. This is because an accurate history and a good physical exam allows you to have an accurate differential workup and treatment for that patient. Also, for those interested in applying in residency, it has become essentially the norm to have passed your CS to be able to be a competitive candidate for a residency application. Step 3. This test plays an extremely important role. This is because this test needs to be passed in order for you to be able to apply for your permanent medical license if you're going to practice as a general practitioner, or in most programs, it needs to be passed before you finish your first year of internship and residency. In general, this test looks to make sure you're a competent physician, that you're adequate to take care of patients, and that you're less likely to commit medical errors that would otherwise be harmful for the patient. So that is all for today. I hope you have a more general idea as to why medical students and physicians go through all these tests throughout their medical training. And if you have any questions or comments, please leave them in the comments section down below. If you like this video, please leave a like and subscribe, as it means a lot. And I'll see you on the next video. In the meantime, I wish you a healthy life. Have a good day.